Imagine waking up with a toothache, but there is no dentist, no painkiller, no toothpaste, no tiny paper cup by a reclining chair. Just your jaw, your fear, and someone holding a sharp stone. Now imagine that this is not a nightmare. This may have been medicine, thousands of years before medicine had a name. Tooth pain is a surprisingly powerful enemy. It can stop you from chewing, sleeping, hunting, speaking, or thinking clearly in the ancient world. That was not just uncomfortable, that could become dangerous, because if you cannot eat, you weaken. If you cannot sleep, you make bad decisions, and if you make bad decisions near predators, nature does not offer refunds. So ancient humans faced a brutal little problem. What do you do when the pain is inside your own skull? For a long time, we imagined early humans simply endured it. They were tough, we told ourselves. They had no choice. We said, but ancient teeth have been telling a stranger story. In 2026, researchers described a Neanderthal molar from Chajyskaya Cave in Siberia. That tooth was about 59,000 years old. It had a deep damaged area connected to decay, and around that damage were marks suggesting deliberate scraping and drilling. Not with steel, not with a buzzing dental machine, with a stone tool. A small hard point was likely rotated against the tooth. That is already enough to make your modern mouth emotionally leave the room, but the most interesting part is not the pain. The most interesting part is the thinking. Someone had to notice that the pain came from one specific tooth. Someone had to decide the damaged part could be attacked. Someone had to control a tool inside another person's mouth. And the patient had to trust them enough not to run into the bushes. That is not just tool use, that is cooperation under pressure. It is also a very old form of courage. Picture the scene for a second. A Neanderthal sits near the mouth of a cave. Their jaw throbs with every heartbeat. Around them are stone flakes, animal bones, smoke, and worried faces. There is no medical school. There is no clean white room. There is only experience, observation, and a terrifying idea. Maybe the thing causing the pain can be removed. Today, we think of dentistry as technology, but the first step may have been much simpler. Pain pointed to a problem, hands reached for a tool, and the mouth became a place of experiment. That sounds crude. But it was not random. Stone Age people understood stone incredibly well. They knew which rocks broke into sharp edges. They knew how pressure changed a cutting surface. They knew that tiny points could pierce, scrape, carve, and drill. If you can make beads, cut hide, shape bone, and butcher animals, you can imagine other uses. A tooth is hard but not mysterious forever. It hurts, it cracks, it traps food, it changes color. It reacts when touched. Ancient people did not need microscopes to notice patterns. They had eyes, fingers, memory, and many painful reasons to pay attention. And teeth preserve those moments better than almost anything else in the body. Skin disappears, voices disappear, a scream becomes nothing, but a tooth can keep scratches for tens of thousands of years. That is why archaeology can sometimes read pain like handwriting. A groove can mean repeated picking. A smooth edge can mean continued use after damage. A drilled hole can turn one person's suffering into a message from deep time. And this message is awkwardly familiar. Humans have always hated tooth pain. We just used whatever technology was available. Later evidence shows the idea did not vanish. At Mayagar, in what is now Pakistan, researchers found Neolithic molars with drilled holes. These teeth were thousands of years younger than the Neanderthal example, but still incredibly ancient. Some date to roughly 7,500 to 9,000 years ago. The holes were small, careful, and placed in molars. That matters because molars are not decorative front teeth. They are deep in the mouth, busy crushing food, and very inconvenient for showing off. In other words, this probably was not ancient dental fashion. Nobody was smiling at a cave party and saying, "Check out my stylish back tooth hole." The more practical explanation is pain, decay, or damage. And again, stone technology may have helped. Researchers have suggested that bow drilling techniques, similar to bead making, could have been adapted for teeth. Think about that. A tool used for craft may have become a tool for relief. The boundary between art, survival, and medicine was probably much blurrier than ours. Ancient people did not have departments. They had problems. If a technique worked on shell, bone, or stone, someone might try it elsewhere. Sometimes that elsewhere was unfortunately inside a human mouth. There's also the famous Neolithic tooth from Slovenia. It was a cracked canine with traces of beeswax on it. The tooth is about 6,500 years old. Researchers suggested the wax may have been used as a filling, not a modern filling, of course. No silver, no resin, no dentist saying this might feel a little uncomfortable, just beeswax pressed onto damage. Perhaps to reduce sensitivity or protect the tooth. It is simple, but emotionally powerful. Because behind that small patch of wax is a very human thought. Can we cover the hurt? Can we make eating easier? Can we buy this person a little more peace? That is the hidden story inside ancient dentistry. It was not only about teeth. It was about keeping someone functional, useful, and alive. A person with a terrible tooth infection may struggle to chew tough food. They may become irritable, tired, feverish, or dependent on others. In a small group, that affects everyone. So treating pain was not a luxury, it was social survival. This is where the story becomes less primitive than we expected. A stone tool in a mouth sounds savage at first, but it also suggests planning, it suggests patience. It suggests that someone cared enough to try, and it suggests the patient believed the helper might make things better. That trust is enormous. Let someone near your aching tooth today, and you want credentials on the wall. Now remove the wall, remove the chair, remove the gloves, remove the words root canal, keep only the pain and the person holding the tool. Suddenly, prehistoric dentistry becomes one of the boldest trust exercises in human history, of course. Not every ancient tooth mark proves medical treatment. Teeth can be damaged by food, tools, accidents. In habits, archaeologists have to be careful. They compare microscopic scratches, they study wear patterns. They test stone tools on experimental material. They ask whether the marks happened during life or after death. That cautious work is what makes the evidence exciting. It is not just a guess based on a weird hole. It is a detective story written in enamel and dentin, and the villain is usually decay. Cavities may feel modern because we connect them with candy, soda, and late-night snacks. But tooth trouble is much older than the vending machine. Ancient diets could include grit from stone-ground food. Hard seeds, tough fibers, and accidental sand could wear teeth down. Cracks and infections could follow. As farming spread, carbohydrate-rich foods created new dental challenges. More grains meant more sticky starches. More starches meant more opportunities for mouth bacteria, and mouth bacteria have never needed civilization to be annoying. They were ready, so the human mouth became a battlefield. On one side, food, bacteria, cracks, and infection. On the other side, fingers, fibers, sticks, stones, wax, and stubborn hope. That is the strange beauty of this story. Ancient humans did not wait for perfect tools. They used imperfect tools carefully enough to leave evidence. A chipped stone became a medical instrument. A bit of wax became protection. A toothpick groove became a clue to discomfort. And a painful mouth became a laboratory. The twist is that dentistry may not have begun with expertise. It may have begun with desperation guided by intelligence. Pain forced attention. Attention created experiments. Experiments became habits. Habits became knowledge. And knowledge, passed from person to person, slowly became culture. That is how humans often invent things. Not because life is easy, because life keeps poking us in exactly the worst place. In this case, literally in the nerve. So the next time you sit in a dentist's chair, remember the ancient version. No bright lamp, no suction tube, no minty paste, no comforting poster of smiling teeth. Just someone trying to solve suffering with a tool small enough to fit in a mouth. It is horrifying. It is impressive, and in a strange way, it is deeply human, because our ancestors were not just surviving hunger, cold, and predators. They were also surviving toothaches. They were solving tiny disasters hidden behind the lips. They were learning that pain could be investigated, not only endured. Maybe that is the real beginning of medicine. Not a hospital, not a textbook, not a perfect cure. Just one person in pain, another person paying attention. And a sharp stone between them. So here is the uncomfortable question. If you had a terrible toothache 59,000 years ago, what would you choose? Would you live with the pain, or would you open your mouth and trust the person holding the stone?